Hello, I'm Dr. Kenneth Ellenbogen from the VCU School of Medicine in Richmond, Virginia, and we're here today at the annual Heart Rhythm Society meetings in Denver, Colorado. It's my privilege to be interviewing Dr. Takashi Yamashita from the Tokyo Cardiovascular Institute in Japan. And Dr. Yamashita today presented in the late-breaking clinical trials the results of the J-Rhythm 2 trial. This is a very important clinical trial that looked at the effects of lowering blood pressure with a variety of different medications on the incidence of paroxysmal atrial fibrillation. Dr. Yamashita, can you please go ahead and tell us about the results of this trial?
First, thank you for your invitation. Neurohumoral factors has been believed to be involved in the progression of atrial fibrillation. Among many neurohumoral factors, the renin-angiotensin-aldosterone system has been believed to be a major part in the progression of the disease. If so, the blockade of renin-angiotensin system will prevent the progression of atrial fibrillation. However, recent randomized clinical trials, including GCF trial or Active-I trial, could not demonstrate the usefulness of ARB for prevention of atrial fibrillation. However, we encounter many patients with paroxysmal atrial fibrillation and hypertension. In Japan, half of the patients with paroxysmal atrial fibrillation has a comorbid condition of hypertension. So clinicians may ask a question, which antihypertensive drug should be prescribed to patients with paroxysmal atrial fibrillation? Any drug is okay, or the role of renin-angiotensin blockers may have some beneficial effects beyond blood pressure lowering events. So we focused on the quality of life of AF patients with hypertension, especially on the frequency of paroxysmal atrial fibrillation, because the frequency of paroxysmal atrial fibrillation is an annoying matter for patients. In the J-Rhythm study, so we compare the frequency of paroxysmal atrial fibrillation under ARB blocking hypertension therapy or under the conventional calcium channel blockers. We enrolled about 318 patients and randomized to ARB blocker and CCB blockers. And their hypertension was controlled by candesartan in ARB blocker group and by amlodipine in CCB group. And the patient transmitted their electrocardiogram by transtelephonic monitoring every day and during the symptom presentation. And we counter the frequency of paroxysmal atrial fibrillation every 4 weeks.
And what did you find in your study? It's a fascinating study comparing an ARB to a calcium channel blocker for the treatment of hypertension in people who have hypertension and AFib. Fascinating. What did you find?
In our study, blood pressure lowering by either drugs had similar effects on the frequency of paroxysmal atrial fibrillation. In both groups, the frequency of paroxysmal atrial fibrillation decreased gradually, but the decrease was not different between the group. So, as in the Active-I or the DCF trial, in clinical situations, we do not mind what kinds of antihypertensive drug should be prescribed for patients with paroxysmal atrial fibrillation. Lowering blood pressure is the most important fact, so any antihypertensive drug will do.
So the take-home messages from this just very important clinical trial are that lowering blood pressure was similar between both the drugs studied,
yes,
the calcium channel blocker and the ARB drug,
yes,
but that neither drug was superior. There was no benefit of one drug over the other drug in terms of decreasing the incidence of symptomatic AF. I think this is the type of clinical trials we really need because hypertension and AFib are just so common and they're often so comorbid. you and your investigators need to be congratulated on what is certainly one of the most important clinical trials in atrial fibrillation. Thank you very much.
Thank you very much.
Great.